Hey guys, welcome back to Vet Ranch. We've got a good case today. This adorable dog here resting under my chin is Peaches. And she looks like a normal, healthy puppy, and in most respects she is. But she has got the most disgusting, gaping belly wound. It's disgusting, and it even like makes a sucking sound when we pick her up. Weirdly enough, she's happy and running around and wagging her tail. Obviously being adorable. Right? So what we're going to do, it's pretty nasty, and I don't think we're going to be able to close it today just because it would just be closing an infection up in there. So we're going to start her on antibiotics, start her on some pain meds, and then probably in a couple days we will try and put a drain tube in there once the infection's under control. She's getting her little diaper wrap on. It's Peaches' big day. Here she is looking all sullen in her cone. We were gonna sew up that hole today, and we still are, but with a little caveat. This little puppy healed so fast that hole's almost all the way gone. Puppy's just, it's like 3 days later it's already healed. But it's really tight, so we're gonna release some of the tension and put a drain in there, and it should heal right up. There was a giant hole right there, and that's all that's left. But you can see it's really tight. There's a lot of tension there, so I'm gonna trim this out and make it a little less tight. We went ahead and did an x-ray before surgery, or before we go to surgery, to make sure there's nothing else that we need to address. This is one hip joint that looks normal, and this is the other hip joint, her left side, that is abnormal. You can see that the ball in the ball and socket is gone. It's dissolved. We call that avascular necrosis of the femoral head, or leg calf Perth's disease. And we don't always know exactly what causes it, but it does seem like smaller breed dogs are more prone to it. And there's not a whole lot to be done. Treat her for the pain. Eventually she will form what we call a false joint there, just like if we did an FHO, where we cut the femoral head off for therapeutic reasons. So she should be fine. She may have a little bit of a limp there for the rest of her life, but her quality of life should be great, and shouldn't really affect her life. I'm just going to incise just a tiny little ellipse here to open this back up, and I'm going to suture it back together so it's not all constricted and tight like that. I think she'll be a little more comfortable, especially with her hip. And then I may or may not put a drain in there. Once I kind of open it up, we'll see how much dead space there is left. Kind of hard to see, but there's still just a tiny little hole right there. I'll try and show it to you. Right in there. And I'm making it a little bit bigger, but not much bigger. That's basically all that's left of that giant hole. I don't even think I'm going to have to put a drain in there. I'm just going to kind of suture it back a little bit better, a little prettier, and with a little less tension, and then that's going to be it. That's amazing how fast puppies can heal. Alright, so there it is. That wasn't much of a surgery, but I do think it'll make her a little more comfortable. And she is a little painful from that necrosis of that femoral head that I talked about earlier. So hopefully this will give her a little more relief. We'll keep her on some antibiotics, keep her on some pain meds. Honestly, as fast as she heals, I bet in 3 days this won't even look like anything ever happened.